Health Matters with the Medicine Center Pharmacy. Now, here's your host, Paul White.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're glad you joined us. Before we begin, I'd like to thank our sponsors, Altman Health Systems, Studio Arts and Glass, and Genier Appraisals and Liquidations. Today, Brad and I are broadcasting from our administrative offices, and our special guest is Dr. Qureshi, cardiologist at Altman Dubal Heart and Vascular Hospital and cardiovascular consultants. Good morning, Dr. Qureshi, and welcome
Morning.
to the show.
How are you? Thank you.
February is American Heart Month. Why do we observe American Heart Month every February? Well, every year, more than 600,000 Americans die from heart disease. The number one cause of deaths for most groups, heart disease affects all ages, genders, and ethnicities. Risk factors include high cholesterol, high blood pressure, smoking, diabetes, and excessive alcohol use. This year's Heart Month theme is Take Up a Healthy Habit. You can pick a new heart healthy habit by like jogging or substituting sodas with water and try to stick with it for a whole month. But I'd like to challenge you to a very important heart health habit. Understand your medication and take it as prescribed. You know that nationally, only about 30% of patients take their blood pressure medications correctly. If you struggle with taking your medications correctly, let us help you manage your medication refills and pack them in individual dose packets to help you follow one of the most important health habits, taking your medication correctly. We'd like to remind our listeners that today's program is available on our podcast. You can download that from the App Store in your favorite smartphone app. Just look for Health Matters with the Medicine Center Pharmacy, and please subscribe to our programs.
So, Dr. Qureshi, welcome again to the show. Please introduce yourself and tell our listeners a little bit about yourself and your responsibilities at Altman Dubal Heart and Vascular Hospital.
So my name is Ataul Qureshi. I'm a cardiologist here. I work in the heart failure side of things. My specialty is congestive heart failure, and I run the CHF clinic here, and responsibilities are linked to congestive heart failure primarily. So my background, I was trained up in Cook County, Chicago for medicine residency, and did my fellowship in Lehigh Valley Hospital in Allentown, Pennsylvania. Then I did a heart failure fellowship 1 year at Westchester Medical Center in Valhalla, New York. So that's kind of my training, and I've been here 3.5 years or so.
Gosh, you've been everywhere. Amazing. So what are the common conditions you treat at Altman?
So in general, at Altman, we provide a pretty wide spectrum of cardiology care, short of open heart, LVAD, or transplantation. We provide a full spectrum of cardiovascular procedures and clinical care. My particular side of things is congestive heart failure. So I'm primarily focused on patients who are having that problem. So as I said, it's a pretty broad spectrum, including procedures and everything else that we can think of, short of a couple of things like transplantation and an LVAD pump.
So your specialty in cardiology, do you do surgery too, or?
So no, cardiovascular surgery would be done by surgeons. So we are on the cardiology side, we are on the medical side. So we do procedures like heart catheterization is a common procedure that is done here, and other procedures include TAVR, which is a valve replacement in the aortic position. Some other procedures include mitral clip and Watchman's. So as far as open heart surgery is concerned, those are done by the surgical specialists. So not us.
How many cardiologists are in the department now?
So we have around 20 cardiologists from subspecialties, and some nurse practitioners and physician assistants along with them. So
yeah, that's amazing. So any other specialty heart issues that you treat?
So I treat, in addition to heart failure, I do also practice general cardiology, which includes pretty much a wide spectrum of cardiac care, cardiovascular pathology. So those are two things I would do: general cardiology and congestive heart failure. I have some other partners that do interventional or electrophysiology, care, and I have a bunch of general cardiology colleagues as well. And some of them are focused on cardiac imaging and other various interests that they have. So, that's kind of where we are.
Is there any connection? Okay, so we have a new cancer center down there a little bit. Is there any connection between the new cancer center and cardiology?
Yeah, so cardiology, there are certain partners that we have that they're interested in cardio-oncology, which is an upcoming field where, patients who are going through cancer treatment and they have side effects related to chemotherapy, cardiac side effects, or interaction between the heart and cancer. So they focus on that. And in fact, there are certain programs in the country that offer a fellowship in that kind of side. So we have some cardiologists in our practice that are focused on that part, collaborating with the cancer team. So,
Doctor, you mentioned that one of your specialties is congestive heart failure. Can you describe what congestive heart failure is for the listeners and help us break it down so it's easy for the non-clinically inclined to understand?
So you got to remember that heart is a pump. Heart is supposed to pump blood. When the heart becomes inefficient in doing its job, some of that blood may accumulate in places where it's not supposed to be. And you may start noticing some water. Water is an important component of blood. Some of that fluid may start building up in your legs, or you may start noticing some shortness of breath because that is building up in your lungs. Or you may start waking up short of breath at night. So some of those symptoms may actually mean that you're holding onto water, and then those may be signs of congestive heart failure. So weight gain is another common one. You eat something which is salty, and next thing you know, your weight has gone up and you're getting more short of breath. You may want to talk to your provider, your doctor or cardiologist regarding those symptoms, as they may be related to congestive heart failure.
Can you give us some idea of, I'm guessing that there's some health conditions that can lead to congestive heart failure?
Right. So, yeah, I think, it's interesting that it's a spectrum. Heart failure is a spectrum, and you can describe them in stages. Stage A is people who are at risk with certain, behavioral things like we're eating unhealthy or obese and those kind of things. Stage B is when they develop structural problems in the heart. They haven't really manifested with symptoms yet. Stage C is our majority of patients who have developed some kind of a weakness or thickness of the heart or some other valve problems. And stage D is the end stage. So we talk about what leads to these stages and what leads to the development of it in the first place. Common things would be high blood pressure is one of the common reasons. Uncontrolled blood pressure can lead to thickness of the heart muscle and weakness. Another really common reason is blockages in the arteries of the heart. That is, in fact, one of the most common. And when we see a heart failure patient, that's one of the things that we think as the first thing. Is this from a blockage or a heart attack or some decreased blood flow to the muscle? Other things could be rhythm-related problems. Atrial fibrillation is a very common rhythm, which can be linked to congestive heart failure. And so many other viral infections can lead to that. So plenty of reasons for it. I mean, just to name a few.
All those sound interesting, and you're painting pictures of different patient types in my mind. Who's typically at risk for heart failure?
So it's an interesting question. I mean, if you look at the heart failure, there are two types of heart failure. A heart failure where the heart pump function is normal, is squeezing normally. And the other type where the heart is weak. It just doesn't squeeze normally. The heart's so-called ejection fraction is less than 50%. A normal range is between 50 and 70%. That's on a picture of the heart. How the heart squeezes is normally between 50 and 70. So you could be either with a heart ejection fraction between 50 and 70 or less than 50. In people who are less than 50%, the poster child would be a middle-aged man related to a blockage in the arteries of the heart or a history of heart attack. And in patients who have a normal ejection fraction, the poster child could be like a middle-aged lady or older lady with normal squeezing function, but just a really stiff heart. So who is at risk would be, depending on the demographics, as we said, be middle-aged man related to blockage, or like an older patient lady related to, those are the, obviously there is a spectrum, and anybody is at risk for pretty much a lot of different things. So we can't really say this group is not at risk for that. There is certainly a lot of overlap between different pathologies.
All right. So at the top of the program, we talked about picking up a heart healthy habit for February. I'm guessing that you have some recommendations for all of us to prevent, as best we can, heart failure and cardiac disease in general.
Yeah, I think that one of the biggest thing is to make sure that we are eating healthy. What is going in our bodies is healthy, and I think staying away from things like, for example, fast food, which has a lot of salt in it. Try to keep our waist small. Okay, there is a direct relationship between an obesity around the waist and cardiovascular problems. It's called metabolic syndrome. So try to keep our waist, and cutting down the carbohydrates, our staples, potato, pasta, rice, sugars. You cannot lose weight with those kind of things. So trying to keep our weight healthy, keeping our salt low, trying to stay away from excessive restaurant and fast food, and participating on physical activity around, like they say, up to 150 minutes per week or something of aerobic activity. So those are the few things that we can do, what goes through our mouths into our body, and what we do to keep ourselves active, and what is our waist doing, and how much obesity do we have.
Wow. Amazing. Okay, so what are the common signs of heart failure, and are they the same for men and women?
Yeah, so we talked a little bit about this. So one of the common signs could be just shortness of breath. I'm not able to breathe. So somebody comes into a cardiology office saying, I can't breathe. That's one of the things to look for. Swelling in the legs, short of breath at night, and palpitations could be a sign. Sometimes even having chest tightness or discomfort as you try to do things could be a sign. So, looking at the ankles, make sure they're not swollen. They're swollen could be a sign of congestive heart failure. For women and men, could be similar, I would say. I mean, sometimes heart attacks and blockages could be somewhat silent in elderly and in females, especially in diabetics as well. So, may not necessarily feel a chest pain with a heart attack. But other than that, symptoms could be very similar.
Wow. Okay, Doctor, our first break is here. You're listening to Health Matters with the Medicine Center Pharmacy. Welcome back to Health Matters with the Medicine Center Pharmacy. Friends, just a reminder to stop by the pharmacy and talk to a pharmacist about our new Health Matters drug savings program. We want to help you stay well and save money. Doctor, I'd like to jump back to the nutrition thing just for a minute. People are consuming large quantities of sugar substitutes. Is there any cardiac issues with these?
Yeah, not necessarily. I think that there's some kind of thought whether there could be linked with cancer and other things. I don't think it has been proven as far as I know. I'm not an expert in the field of these substitutes, but as far as the heart is concerned, I don't think there's anything that I can think of. But I do know that if you eat sugar and you're getting obese and other risk factors are linking to getting diabetic, then certainly that will lead to heart problems. So I think we have to be careful with ingesting that. So.
Okay. Is it more common for women to overlook symptoms than men about heart?
I guess if somebody did not get a symptom, classic symptom of heart attack, like a chest pain and things along those lines, because of being a woman, that could potentially be an issue. I think that it may be rather personality of a given patient or person to not be, concerned about the symptoms. And it could be so men versus women could be. I don't think there'll be a little difference between them. I think otherwise. So.
Okay, so a heart attack. Okay, is it right down the esophagus part of the chest, off to the left, off to the right?
Usually retrosternal discomfort right in the center of the chest. and may feel like heaviness or tightness or pressure, may go to the arm or the jaw or to the back, and may sometimes even go to the upper part of the stomach and be nauseated or dizzy. So there can be situations, and maybe even sweating, profusely sweating in the be a symptom. So
why does it go to the jaw?
well, it could be embryologically similar kind of region between the heart and the jaw, I guess. That may be the reason for some of these pains to refer over to different locations because of how the organs originated when being is born. So
Interesting. So if someone's experiencing symptoms, what do they do?
well, the best thing is if you're having chest discomfort is not to tough it out, but rather to go to the ER immediately, because time is muscle. If you have a blockage and you don't go and get prompt attention, you may develop really long-term consequences, which is loss of heart muscle and congestive heart failure. So, or otherwise death and rhythm problems. So best to go to the ER as soon as possible within 10 or 15 minutes of chest discomfort. And if it resolves, then still, I think promptly getting attention from your cardiologist or your primary care doctor or even the ER would be a good idea.
I think one of the disturbing things about a heart attack or not a heart attack is that a lot of people have digestive issues, esophageal, that sort of stuff, and it can be confused with a heart attack. I'm wondering how many people show up at the emergency room with digestive issues and think it's a heart attack.
That's a good question. I mean, sometimes the digestive issues can lead to similar discomfort that may actually get relieved by nitroglycerin, because nitroglycerin relax the esophageal muscle. So yeah, I mean, I think the problem here is it's like the boy who cried wolf. Like you don't know which one is what. So sometimes be safe rather than sorry. And now, if you know your body and you already had a heart attack before, and you may make a judgment call in that situation, but yeah, I think have to be careful.
What kind of gets me is people, I'm going to use the word Mexican, but there's so many Mexican restaurants around now, and the foods are so highly seasoned. I just wonder how many people mistake that stomach issue for a heart attack.
No, I hear you. I mean, I think that certainly those two things can go along. That's they can closely resemble each other, but I think that unless you can really be super, unless you can definitely exclude the heart, I don't think that taking any chances with the heart is a good idea. So
sure, okay, all right.
Why don't we talk about hypertension in pregnant women?
So hypertension can be a common issue in pregnancy. It can have a couple of manifestations. One of them is called eclampsia, where it can be associated with seizures and uncontrolled high blood pressure. And the other one is called preeclampsia, where you don't have seizures. The treatment is different because certain medications cannot be used in pregnant patients. And for example, ACE inhibitors or ARBs like lisinopril, losartan, one of those common drugs, are not utilized. So certain other medications may be necessary, certain beta blockers or methyl dopa or some other drugs that are specifically are slightly safer in or as compared to the conventional medications in pregnant patients. So as far as that is concerned, and as I said, it can be really risky because if you are developing seizures along with with this, I mean, that can be life-threatening. So certainly getting good prenatal and during the pregnancy, seeing your OBGYN and your primary care providers on a regular basis is absolutely crucial to keep an eye on the blood pressure and make sure that you're not having one of these issues.
So we know smoking is bad for people and causes COPD. Does it also lead to heart failure?
Yeah, smoking can lead to heart failure if it leads to a blockage in the arteries of the heart. So we keep talking about blockages and over again. But if you develop a blockage, you develop a heart attack related to smoking, then you may be left dealing with heart failure, especially if you have a scar in your heart from that heart attack. Then you may be dealing with a heart that is weaker, not able to pump blood. And then you get all of these things talked about: swelling in the legs, waking up short of breath at night, unable to do your things without getting short of breath. So all of the above. And certainly it can all be traced back to smoking. So it comes back to primary prevention. Prevention is better than cure. So I think if you start making a change in your lifestyle, stop eating that fast food, cut down on your waste, cut down on the smoking, start doing the activity, you may not be dealing with all of the problems that can come as part of being a heart patient. So,
do you care to take a moment to comment before our news break on the dangers of vaping versus smoking?
So, smoking has so many chemicals, like somebody said, like up to 7,000 chemicals, a lot of chemicals. So, long story short, there may be a lot of chemicals in smoking, and vaping, it may be somewhat better from that angle, maybe, but again, you're still taking in substance that is probably, nicotine based or some other chemicals in it. And, we have sometimes seen like really fulminant lung failure, or pulmonary issues from it, even seen people go on a breathing tube after vaping. So overall, I would say I would discourage this strongly. I would say don't vape, don't smoke, don't put anything in your body which is not supposed to be in there.
First time I saw somebody vaping in a car, the steam comes out of the driver's side like the car's on fire. And I was like, hey, the car's on fire. So anyway, they make too much smoke. Okay, we are at break time, I guess, huh, Brad?
Yep.
It is the bottom of the hour and time for the news. Thanks for joining us this morning on Health Matters with the Medicine Center Pharmacy. Welcome back to Health Matters. I'm your host and pharmacist, Paul White. This morning, we're talking with cardiologist Dr. Qureshi at Altman Dubel Health and Vascular Hospital, and also with cardiovascular consultants. So, what about secondhand smoke? We hear all about secondhand smoke constantly.
Yeah, I would still advise against secondhand smoke. I think that, I think that smoking, vaping, secondhand smoke, all of them can have contribution towards development of cardiovascular disease, in my opinion. So if somebody who's smoking around you needs to smoke, he probably should not smoke, in the same area, so that you're not getting secondhand smoke. So I advise my patients to avoid that. Many of my patients are really sick and they have underlying lung disease or pulmonary hypertension or heart failure, and they cannot afford to get sicker from any standpoint, whether it comes to direct lung damage from all the carbon and soot and everything else that goes in, causing issues there, or the chemicals like nicotine and everything else that is in it.
How many doctors do you have? I think you said 20 some. Is that correct?
Yeah.
Actual physicians or
Right.
total team?
No, those are the actual physicians, and then we have advanced practice like APPs, nurse practitioners, or physician assistants on top of that. So pretty robust group. Yeah.
Okay. What are some of the specialties of other physicians? I mean, I know we have cardiac surgeons,
Yes.
of course, and we've had other cardiologists on the program before from Altman, and just some very interesting things, like, well, how they replace a valve. They just crush it and put a new one in, and it was just kind of amazing. In fact, I was talking to somebody the other day, and they said they had a valve replaced, and the patient did not know that the valve was left, and it was just from another facility, that the valve was left in there and crushed, and I thought that was pretty amazing. Why doesn't it get in the way? I guess the old one.
Yeah, so some of the other specialists, like interventional cardiology colleagues who do stents, some of them also do structural heart. We call it structural heart, and we have two providers in our practice that are structural heart. They put these valves in, called TAVR valves, which go in the aortic position, and the old valve gets crushed and to the side. It's just like a bigger stent. It just kind of crushes it to the side. So if you put a stent in somebody's artery, you also kind of crush all the gunk and whatever is in it to the side of the walls of the blood vessels. So yeah, get in the way, just gets replaced by the
and that doesn't cause problems later on, or
not usually. No, not usually. I mean, typically everything goes really smoothly and it's just good as new kind of thing. So.
And more surgery is done by laparoscopy technique than used to be, breaking open the entire chest and.
Well, still sternotomy is still like cutting open the sternum is still the pretty much the conventional and most common way of doing surgery. There are certain surgeons that not in our system which can do through mini thoracotomy through the side, like a smaller incision. But majority of surgery done across the country is still through regular sternotomy, cutting open the chest.
Okay.
So, yeah, some of the other specialists that I want to mention in our practice are electrophysiology colleagues. They deal with the electrical and rhythm part of things. So we have 4 of them in our practice, which is really, really good. And some of the other ones are imaging doctors. They read MRIs and CAT scans related to the heart. And then we obviously have general cardiology colleagues, which we cover a pretty wide territory, go up an hour from where we are to cover clinics and hospitals and so on. So a pretty diverse and hardworking group when it comes to taking care. And I think all of them do a really good job, and they're really invested in their patients. So.
Did we cover all of the specialties that you do in your practice?
Yes. So I'm primarily a congestive heart failure specialist. I do also see general cardiology, which pretty much means can see any cardiology related matter. And if I need to refer over to another specialist, like an interventional cardiology guy that needs to stent the patient, or somebody needs a valve we talked about, or electrical problems, or some other things, then we can refer them to that specialist. So that's what general cardiologist does. The full spectrum. If they need to be referred, they will. Otherwise, they will continue to treat the patient. So
I ask this question of every cardiologist we've had on the program over the years. We have been on the air for 13 years now, and where are we in heart transplants?
So heart transplant has changed a little bit recently in the last couple of 2 or 3 years. The transplantation, the way we allocate organs has changed. So previously, there was a criteria that was, we were listing them as 1A, 1B, status 2, that was the previous listing criteria. Now it's status 1, 2, 3, up to 7. The way we risk stratify or place sicker patients on the list has improved. So patients who are on ECMO, who are sickest of the sick on heart-lung support, they are now highest up on the list. Previously, in the previous conventional system, somebody who was on ECMO and somebody was on balloon pump, which is a smaller pump, they were kind of looked at similarly in the same kind of with the same eye. But with the current system, the sicker you are, the more gadgets and pumps you're requiring, the higher up you will be on the list. And so the organs are allocated towards sicker individuals that need it the most. As far as trying to get the organ over, so you kind of keep in mind that there's a donor, somebody somewhere in the country. So you may have to fly over, let's say, to Pennsylvania to get the heart. So we have certain machines, like Transmedics is one of them. Like you put the heart in a machine that can keep it viable for longer, so it doesn't get damaged while out of the body of the donor. So there are certain improvements there. Heart transplant survival is around 90% plus at 1 year, and it still is the gold standard for treatment for stage D, which is the advanced heart failure. And but the heart pumps, which are really getting better. It's like technology. As you know, technology gets better with time. We can look at smartphones, how they have evolved. So those things are getting better with time. So we have better short-term pumps that are needed to support patients and long-term pumps to help with patients who need a heart pump like or an LVAD. So those things have also improved, and I think they may ultimately catch up with heart transplant. So I think that we'll see how things evolve, but yeah, that's the summary of that.
Interesting.
Building on your technologies and advancements, just thinking back to pharmacy school when I was a student at IU Med Center in Indiana, I did a cardiology rotation, and it was fascinating to see how you and your colleagues operated. And to hear you talk about how even now, a cardiologist isn't just a cardiologist. You have all these different levels of specialties because it's so complex and so many nuances to know. Can you talk about the latest advancements and how, is there anything that stands out that's helped you do your job better, more effectively, or diagnose patients better or more effectively?
The field has evolved tremendously. I mean, starting off with even diagnostic images like MRI of the heart is now a common practice. We use MRI in addition to just regular ultrasound or echo to define if there's any scar in the heart, is there any inflammation in the heart. It gives us an additional imaging diagnostic tool. We certainly have other imaging modalities, CAT scans that are specialized to look at the heart and so on. So, and same is true for interventional field. I mean, they have certain tools. They can look at the blood vessel from inside through an ultrasound or other means. So the diagnostic things have improved significantly. As far as treatment is concerned in cardiology, that has really been improving. Like we have really game-changing drugs like sacubitril, valsartan, and things like dapagliflozin and pagliflozin that are Jardiance and Farxiga as generic a trade name, and Entresto. Those medications have really been really helpful, especially the Entresto, I would say, to change the course of our patients' care and take them away from trouble back towards a better situation. So, and I think that other devices have improved, like pacemakers, defibrillators, they have evolved. And we talked a little bit about the heart pump LVADs. We have other devices like CardioMEMS is a device that can be put in and it can transmit somebody's water levels, like congestive heart failure patients' volume status remotely to us. And certain ICDs and defibrillators, pacemakers can also transmit that data regarding fluid and water. So it's just wherever you look, whether you look at the diagnostic front or medication front or procedural front or so on, there has only been improvement, in my opinion. And it's just evolving for the better, I think. So,
Are we at our final break, Brad?
Yeah, we should do it.
That's good. Okay. You're listening to Health Matters with the Medicine Center Pharmacy. We'll be back in a few minutes. Welcome back to Health Matters with the Medicine Center Pharmacy. I am your pharmacist, Paul White. Thanks for joining us. Let's get back to the last segment of the show.
Okay. All right, doctor. I guess we've been talking a lot about technology and how things change, and kind of wondering, which developments have had the most impact on your patients? I mean, I'm thinking that it must be endless.
I think the one I would say that has the most impact would be medications. I think most of the hearts get better with medications. And if we didn't have these medications, it would be very difficult to manage these patients. So things like etropiol, carvedilol, Entresto, Jardiance, Farxiga, those medications, spironolactone, obviously the diuretics, they have the biggest impact in the majority of patients when it comes to congestive heart failure. When it comes to just general cardiology patients and other patients having heart attacks, putting stents in there has had a great impact. When somebody comes in with a heart attack, that has been a game changer for the whole cardiology, practice across the country. So I think that's pretty much what I would say. Now, everything that you can think of will have some impact. Defibrillators, you can say they save a lot of lives. For people that go into rhythm problems related to heart failure. So it's our practice to put them in if your squeezing function or ejection fraction is less than 35%. despite being on medications and everything like that. And certain types of defibrillators that put a third lead in there to correct something called a left bundle branch block or a sluggish electricity as it flows through the heart. Has those could have profound impact on patients. So I think that no matter which specialty you look at heart failure, you look at stenting specialty, electrical specialty, imaging specialty. There are other specialties like congenital, adult congenital, and so on. Cardio oncology we talked about. No matter where you look at, you will certainly find things that are having huge impacts on our patients' lives and making people live longer, feel better. In fact, now we have a drug called tafamidis, which can help people with patients with cardiac amyloidosis related to a special amyloidosis coming from the liver called transthyretin. And we were diagnosed with them a few years ago, but we were not able to treat it. But now that drug is commercially available, so we treat our patients with cardiac amyloidosis with medications as well. So yeah, no matter where you look, you'll find something.
What do you think, based on, I'm sure you've seen a lot in your experience. Are we as a population listening to the recommendations that you're sharing today? Are we trying to eat better as a whole? Are we still careless and think we're invincible and then wind up in your office one day because we lived life carefree? I mean, what kind of themes can you leave for our listeners today? And maybe something you say today has touched them and made them think twice about, like you said, your waist, how big your waist is, and your metabolic syndrome and things. And it seems like there's so many things that we need to do proactively. It seems overwhelming at times, but I'm just wondering what your overall takeaway is with the patients you see daily now.
Yeah, I think that, cardiovascular disease, the pathology is environment, depending on your genetics and environment. Right, you can control your genes. We do see those patients who are relatively healthy, not obese, and they still develop profound triple vessel disease at age 50. And then how did that develop? Even though their LDL is not too high, but still they develop something. So we don't know everything about how our bodies are and how our genes play a role. But what you can control is in your environment, what you eat, how much exercise you do, whether you smoke or you vape, whether you take care of your body in those ways. So if you don't do that, then yes, then you are partially responsible for this kind of thing. So I think that we have to take ownership of our own situation. Now, if you do end up becoming a heart patient or congestive heart failure or other things, then we also see patients who don't want to follow recommendations. They don't want to take your medications properly, or they don't want to do other things that are asked of them. So I feel like the taking some ownership would be the right idea, even before you ever develop disease, and certainly after you develop any heart disease. So recommendation would be, take home message is to take care of your body, do the exercise, cut down your carbs, cut down on your fast food, and I think try to make healthy lifestyle changes so that you don't run into these problems. If you do end up running into problems, whether it's genetically driven and was none of your, nothing to do with environment or whatever it was, then I think we just be compliant with recommendations of physicians, and hopefully that will help the situation. So
I think, we do have, I'm thinking about a couple patient interactions I've just had in the last week in the pharmacy, and one of them touches home on what you've just said. And the one patient came in this week and she's a little intimidated because she has some heart conditions, and there was a new medication that she was put on. And it was interesting talking with the patient because she was reluctant to take the medication. And it wasn't because she didn't believe the doctor. It wasn't because she didn't feel she had a problem. She just didn't want to take one more pill. And, it was one of those things that I think we struggle with in the pharmacy, and we try to help patients understand that, your doctor has or prescriber has a wealth of knowledge, and they are looking at your situation and trying to help you solve your problem so that you can still go play with your grandkids, and you can go walk in the park, or you can travel with your spouse. It's not because they want you to take one more medication. It's because they want to try to help you deal with the situation you've got in the best way you can. And I guess I would encourage patients listening today, if you don't understand why you're taking a medication, that's what we're here at the pharmacy for. Stop in the medicine center. We can talk to you about your medication, help you understand the why. No doctor is going to give you a medication just because they want you to take another pill. They're trying to help you solve a challenge you're facing. So it is important. Medications that you don't take don't work. And when you go back to the doctor and they see that you're not improving, then they're probably going to give you something else. And if you don't come clean and communicate with your doctor and tell them, look, it's expensive. We get patients that come in the pharmacy every week. This medication is too expensive. I can't afford it. So I split doses, or I take it every other day. Well, that creates another problem for both you and the provider, because then the prescriber doesn't know you're not exactly compliant. If they think you're taking it as they prescribed it and your blood pressure is still high, then they're concerned and they want to help you solve that. And it's a cascade and just keeps rolling. So we try to be partners on our end for you that way. So.
No, I appreciate that. I would say 2 brief points there. One of them is for treating a weak heart, ejection fraction less than 50%, 4 medications need to be added on to help, and they all have data behind them, which includes Entresto, lisinopril, losartan, one of them, a beta blocker, spironolactone, and Jardiance, or Farxiga, one of the SGLT2 inhibitors. So we're not doing it for fun. We're trying to give you the best chance to get your heart better. That's point number 1. Point number 2, if you go to the pharmacy, and you say, hey, you got to pay $400 for this, otherwise we're not going to give you the drug because that's what it costs. Then go talk to your doctor, call your doctor, say, is there a coupon? Is there anything else available? Talk to your pharmacist as well. Also talk to your doctor and say, hey, I just couldn't afford it. Don't do that. And when you come for the next visit, call them, say, what else is out there? Can you help me? Is there any assistance available through the company or whatever else? So just keep those two things in mind, that any drug that we're giving, cardiology is one of the specialties which has a lot of evidence based behind everything we do. There's a research trial behind everything that is done. So it's not for fun, or a doctor just likes to prescribe drugs. It is for your optimization. If the doctor only gives you 1 pill, say, hey, see you back in a year, he's not doing you justice. Okay.
Yeah.
You get that heart better.
All right. Before we wrap up, Dr. Qureshi, I guess I'd like, can you give our listeners one more time your contact information and where you practice, and any other closing comments that you want people to make sure that they are here today from you?
Yeah, so you can contact us in cardiovascular consultant 330-454-8076. That's our main number. You can call us, and I think they'll be able to help you with channelizing to whichever provider you want to see. I think that information is also available on the Altman's website regarding various providers that are here, cardiology providers, and I think that we'll be more than happy to help out in any way. So.
Excellent. Well, it's been great talking with you today, Doctor. We appreciate you taking time out of your busy schedule. I guess to reiterate what we said at the top of the show, pick yourself a heart healthy tip to start here in February. Watch that salt and intake and get some exercise, and please see, if you don't have a regular physician that you see yearly, please find one. If you need help, stop in the pharmacy, we'll get one. But you got to talk to your providers, and please don't be afraid to ask questions.
Thank you.
We're out of time, I guess, right?
Yeah.
Okay, Dr. Qureshi, thank you very much. Cardiologist at Altman Duval Heart and Vascular Hospital and cardiovascular consultants. We would like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. Thanks to our sponsors, Altman Health Systems, Studio Arts and Glass, Genuine Appraisals and Liquidations. As always, we thank you, listeners, for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we'll see you right here again next Friday on News Talk 1480 WHBC.
Thank you.
Thank you very much, Doctor. Very interesting.